Hi everybody, this video of mine is about scarlet fever, which is a bacterial illness that develops in some people who have streptococcal throat infection. This is also known as scarlatina. This features a bright red rash that covers most of the body. Scarlet fever is almost always accompanied by a sore throat and a high fever. Scarlet fever is most common in children 5 to 15 years of age. Although scarlet fever was once considered a serious childhood illness, antibiotic treatments have made it less threatening. Still, if left untreated, scarlet fever can result in more serious conditions that affect the heart, kidneys, and other parts of the body. Yesterday, I made a video about tonsillitis. Most of the causes of tonsillitis are viruses, but some cases are due to bacteria, and this streptococcal infection is one of the causes of tonsillitis. And if you have not seen that video, please see that video. And this the same bacteria, streptococcal group A beta hemolytic streptococci, that's the full name of this bacteria, is also responsible for this scarlet fever. Now coming to the symptoms. The signs and symptoms that give scarlet fever its name include red rash, because scarlet means red, so the red rash is the most prominent feature. The rash looks like a sunburn and feels like sandpaper. It typically begins on the face or neck and spreads to the trunk, arms and legs. If pressure is applied to the reddened skin, it will turn pale. Red lines. The folds of skin around the groin, armpits, elbows, knees, and neck usually become a deeper red than the surrounding rash. Flushed face. The face may appear flushed with a pale ring around the mouth. Strawberry tongue. The tongue generally looks red and bumpy, and it is often covered with a white coating early in the disease. That's why it is known as strawberry tongue, because it resembles strawberry. The rash and the redness in the face and tongue usually last about a week. After these signs and symptoms have subsided, the skin affected by rash often peels. Other signs and symptoms associated with scarlet fever include a fever of 101 degree Fahrenheit or higher, often with chills, very sore and red throat, sometimes with white or yellowish patches, difficulty swallowing, and large glands in the neck, which are lymph nodes that are tender to the touch. Nausea or vomiting. Headache can also occur. You should talk to your doctor if your child has a sore throat with a fever of 102 degree Fahrenheit or higher, swollen or tender gland in the neck, or red rash. Now coming to the causes of scarlet fever. This is caused by the same type of bacteria that causes streptococcus throat. The streptococcal bacterial infection is the cause of this scarlet fever. In this fever, the bacteria releases a toxin that produces the classical rash and red tongue. The infection spreads from person to person via droplets expelled when an infected person coughs or sneezes. The incubation period, which is the time between exposure and illness, is usually 2 to 4 days. Coming to the risk factors. Children 5 to 15 years of age are more likely than are other people to get scarlet fever. Scarlet fever germs spread more easily among people in close contact, such as family members or classmates. Now, let me tell you the complication. If scarlet fever goes untreated, the bacteria may spread to the tonsils, lungs, skin, kidneys, blood, middle ear. Rarely, scarlet fever can lead to rheumatic fever, which is a serious condition that can affect the heart, joints, nervous system, and skin. Now let me tell you the prevention. There is no vaccine to prevent scarlet fever. The best prevention strategies for scarlet fever are the same as the standard precautions against infection, such as wash your hands. Show your child how to wash his or her hand thoroughly with warm soapy water. Do not share dining utensil or food. As a rule, your child should not share drinking glasses or eating utensils with friends or classmates. This rule applies to sharing food too. Cover your mouth and nose. Tell your child to cover his or her mouth and nose when coughing and sneezing to prevent the potential spread of germs. If your child has a scarlet fever, wash his or her drinking glasses, utensils, and if possible, ties in hot soapy water or in a dish dishwasher. Coming to the diagnosis of scarlet fever, during the physical exam, your doctor will look at the condition of your child's throat, tonsils, and tongue. Doctor can feel your child's neck to determine if lymph nodes are enlarged. Doctor also assesses the appearance and texture of the rash. Throat swab is also taken. If your doctor suspects streptococcus is the cause of your child's illness, he or she will also swab the tonsil and back of your child's throat to collect material that may harbor the streptococcal bacteria. Tests for the streptococcal bacteria are important because a number of conditions can cause the signs and symptoms of scarlet fever, and these illnesses may require different treatments. If there are no streptococcal bacteria, then some other factor is causing the illness. Coming to the treatment, if your child has scarlet fever, your doctor will prescribe an antibiotic. Make sure your child completes the full course of medication. Failure to follow the treatment guidelines may not completely eliminate the infection and will increase your child's risk of developing complications. Your child can return to school when he or she has taken antibiotics for at least 24 hours and has no longer fever. I'll tell you some lifestyle and home remedies. You can take a number of steps to reduce your child's discomfort and pain. First of all, you should treat fever and pain. Use ibuprofen or acetaminophen, which comes with the name of Tylenol, to control the fever and minimize throat pain. You can provide adequate fluids. Give your child plenty of water to keep the throat moist and prevent dehydration. Prepare a salt water gargle. If your child is able to gargle water, give him or her salty water to gargle and then spit out. This may ease the throat pain. Humidify the air. Use a cool mist humidifier to eliminate dry air that may further irritate a sore throat. Offer lozenges. Children older than age 4 can suck on lozenges to relieve a sore throat. Provide comforting foods. Warm liquids such as soup and cold treats like ice pops can soothe a sore throat. Avoid irritants. Keep your home free from cigarette smoke and cleaning products that can irritate the throat. I hope you like this video of mine. These precautions are same as I discussed in the video of tonsillitis. Till now, if you have not subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away from YouTube. And if you think that my videos provide some sort of benefit to you, even if it is a little bit benefit, please like the video and share this video with your family and friends and through social media such as Twitter and Facebook, so that other people can also get benefit from my videos.